sitting positions during pregnancy. So there's a lot of talk about this, some big myths swirling around about how we should sit versus not sit during pregnancy. First of all, the goal is not for you to have another thing to stress about. The goal is for you to have a tool to help you while you have to sit anyway, to do it in a way that is optimizing and getting your body ready for birth. So it's not about always adding more things into your day. It's about doing what you're already doing in a more balanced way so that you and your baby can work together in the most optimal way for this journey of pregnancy, birth, and beyond. So let's talk about it. How do we sit in a chair regularly? So here's one of my dining chairs, and the majority of folks, when they sit in a chair, they do what? They do this, right? We tuck the pelvis under. It's known as a posterior pelvic tilt. I'll show it with this. We tuck the pelvis under, known as a posterior pelvic tilt. In fact, a lot of chairs are actually called bucket seats, where it's lower in the back than the front, which is essentially forcing us into this posterior pelvic tilt. So what are some issues associated with spending the majority of our life in this position? So first of all, it's not that this position is evil or wrong. It's just that if it's what we do most of the time, our body is going to adapt not to what we do in the gym, right? But what we do the majority of the time. So if the majority of your time in your life is spent in this position, our body is going to adapt. Let's look at what might happen. So there is tissue that starts on the bottom of your feet, wraps up your calves, hamstrings, sacrotuberous ligament, all the way up to the top of your head. So these tissues, what do you think is happening when I am in a tucked under position? You see the tissue, the area between my sits bone and the back of my knee is shortening. Now let's look at that on the pelvis model. Here is the sacrotuberous ligament. When we are sitting and living in a tucked under pelvis, this ligament is having to live in a shortened position. Our body adapts to how we use it, and so if we don't ever need length in that tissue, it is going to shorten. So we're going to have a lot of compression back here for someone who tends to sit a lot with a tucked under pelvis. So what can we do about it? First, let's dispel a myth. So there is a myth going around the internet that when you sit with a tucked pelvis, your baby is going to rotate into what's called a posterior position. So here's something that I don't want you to freak out about, because babies are not so floppy in there that when you come back, they're going to rotate with you. If that were the case, we'd have much more posterior babies. So that's not the issue. The issue is that when we are in this position, we're creating a lot of shortening and compression along the back side of the pelvis that needs to be able to move out of the way for childbirth. So if this stuff is really compressed and tight, the sacrum can't move out of the way as easy for childbirth. So let's look at an option. So what is neutral pelvis? So first of all, just finding the bones on your own body can help you identify where you are versus neutral. The goal is not to force yourself into neutral, it's to become aware of where you are in relation to it, and then to use tools and movements and awareness to help us get more towards neutral. Neutral pelvis is these two little bony knobs called your anterior superior iliac spine, ASIS, frontal hip bones. Don't need to know the name of it, but it is these two sticky outy bones in the front. So go ahead and find your two little sticky outy bones here. And then what I want you to do is to find your pubic bone in the front. Now, these bones are designed to be stacked in what's called a vertical plane. So if I come to the side, I am finding my ASIS and my pubic symphysis, or my pubic bone, and those should be stacked vertically. If I bring the pubic bone forward, you can see now I'm in a posterior tilt. That is creating a lengthening load of these tissues and a shortening load of these tissues. Now, if I find an anterior pelvic tilt going the other way, it's the opposite, big curve in the low back. So neutral is that place in the middle. But if you are used to this, it's gonna feel weird to find neutral, right? So if I've been sitting like this for most of my life, I don't want to force myself to neutral, because that's going to create a thrusting of the rib cage and probably some gripping of the low back. You're going to say, Lindsay, this doesn't feel good. Now my back hurts. What's the point of neutral pelvis if now I have pain, right? So the goal is not to force it. The goal is to bolster yourself there. So what that looks like is getting something like a towel. This is just a bath towel and I'm gonna roll it up and I'm gonna sit on it. So now the goal is to relax into neutral. So if I can raise my sits bones up on something where my sits bones are higher than maybe my back of my knees, now I can bolster myself, I can relax forward into neutral without using my low back or thrusting my ribs. So you should be able to be comfortable, your ribs should be able to relax down, you should feel no low back tension in neutral pelvis. And now if I check my ASIS, I'm in pubic symphysis, I'm stacked and it feels comfortable. I can go about my day with a neutral pelvis. So this is a really great option for people who sit at desks or who sit all day. Another common issue we see is the leg cross. So again, there is no bad movements. This is not evil, and you're not gonna have a malpositioned baby just because you cross your legs sometimes or you tuck your pelvis sometimes. The goal is to not get stuck in one position. So if you always cross your legs, let's say one direction, spend some time doing the other direction, and especially as you get towards that third trimester, see if you can avoid the leg crossing and the hip hiking altogether, and see if you can find a more neutral sitting posture. When we sit with our legs crossed and we hike one hip up higher than the other, it's not ideal for baby's position in the pelvis. Because what's happening is we are shifting the pelvis in a way that baby has to navigate that compression. So if one side is more compressed, baby's gonna go to the other side, or maybe they'll even tip their head to the side to make their journey through the pelvis. If baby's tilting their head to the side, known as asynclitic, it's a larger surface area. It can make the birth take longer or be more intense. And so working on or working towards neutral pelvis is a really great option to help folks to have a more easeful birth. Let's look at it on the floor. I think sometimes people think that bolstering means that their body is not good, but actually bolstering is meeting our bodies where they're at, which allows us to move forward. And so bolstering is very important when we're sitting during pregnancy, especially because that added load of pregnancy just makes this stuff all the more important, because what might have been an issue prior to pregnancy is really going to possibly show up as a symptom when we have all the extra weight, all the extra stuff inside our abdominal cavity. So what I want you to do is sit on the floor and think about how you're sitting, right? Do most of us try to just kind of go into this position? Now, the goal isn't to then, remember, use my low back muscles and arch my back to get myself neutral and just now force this for the rest of my pregnancy. No, the goal is to bolster into a state of ease. So I am a big fan of yoga bolsters. What you're going to do is you're going to sit on the yoga bolster and you're going to allow yourself to relax forward off of it into neutral. So you see now it's almost as if I'm falling forward off the bolster, and now I'm in neutral pelvis and I don't feel that my back is kind of pulling me there and I'm not thrusting my ribs to get there. So this would be a really great option for a sitting position. Maybe you go to a yoga class or you're sitting on the floor with your kids or whatever. Grab a bolster, grab a yoga block, grab a few sets of pillows, and sitting like this can feel really comfortable, and it's setting yourself up for a really balanced pelvis, which is going to help you for pregnancy, for birth, and for recovery. Now go ahead and extend your legs long and notice what happens to your body. Do you see how, because now I have my posterior chain in the equation, the tension in my calves and my hamstrings, which we all have, you see now I can't bolster myself into neutral. What do? Do I need to force it? Or Lindsay, I did this and it still didn't feel easeful for me. That's okay. We're all at a different place. We all have different tension. This one, crossing my legs, took out the tension in my posterior chain out of the equation. But now you see, for me, I have to bolster higher because this does not feel easeful for me. So I would need to add a second bolster if I were extending my legs in order to find neutral. Now I have two bolsters, and now you can see, not that I'm often sitting with my legs extended like this, but you can see now I can find neutral and it feels easeful. And so wherever you're at, bolster yourself up until you feel like you can relax forward into neutral. Remember, ASIS over pubic symphysis in a vertical plane. And that is going to really set you up for a lot of success moving forward through pregnancy and birth. Okay, I don't know about you, but I love watching TV shows at night with my husband. And I thought to myself during pregnancy, shoot, what am I going to do? Because what do? We sit and we round in the couch or in bed and we sit like this. That's not ideal, right? It's not ideal for anyone, but it's especially not ideal during pregnancy. And so what I suggest for people when they're watching TV or they're wanting to rest, you don't want to sit with a neutral pelvis all day, right? You're like, I'm tired, Lindsay, I want to rest. Can I just lounge back? Here's my suggestion for you. So when you are at the end of the night, you're ready to wind down, watch whatever show you're binging right now, I suggest a side lying position because then you don't have to sit with a neutral pelvis. You're still up, but you're a little more neutral. And so coming into a side lying position, you could put something between your legs, you could bolster yourself up, and you just hang out. Maybe your partner gives you a foot massage. They can sit up, you can pass your legs that way. Win-win, you get to be more neutral and you get a foot rub. Amazing. There is not one right position to be in. The next position is the best position, meaning we are not designed to sit in one position all day. So if you have to work at a desk for a lot of the day, take movement breaks, take stretching breaks. Make sure that you're constantly moving. Maybe you're sitting in a chair, bolstered into neutral. Now you're sitting on the floor. Now you're doing standing. Now you're going for a walk. So think about moving more and finding variety in your tissues because remember, our body adapts to how we use it. So if we only use it in a few ways, it's not going to be able to be as adaptable and as mobile for the birthing process. Again, when this stuff is really compressed, it can also create issues with back pain, incontinence. It can make the issues of the core worse, the abdominal separation. And so creating a lot of compression here is not ideal during pregnancy. And we want to work to create length and strength and stability in all of these tissues so that we can support pelvic balance for a more easeful birth, but also so we can support pelvic balance so we can get rid of things like round ligament pain, pelvic pain, sacroiliac joint pain, sciatica. A lot of those things have to do with an imbalance in the pelvis. And when we work towards neutral pelvis, both with tools, but also with just how we're choosing to sit all day, we really set ourselves up for a lot of success moving forward through the pregnancy process.